Hello and welcome to our presentation on the Kansas Physical Therapy Dry Needling Requirements. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance website that specializes in physical, occupational, and speech therapy. We offer monthly live, full-length continuing education courses, guides and sample policies for Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important federal laws, information and updates for most private insurance companies, including Medicare Advantage plans and Medicaid plans. We are working on PT, OT, and SLP compliance guides for all 50 states, along with information on Medicaid, workers' compensation, home health, and pediatric services. And we offer ongoing and comprehensive support for our members, which means that members can email us with any therapy, compliance, or billing questions for no additional cost. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. Dry needling means a skilled intervention using a thin filiform needle to penetrate into or through the skin and stimulate underlying myofascial trigger points or muscular connective tissues for the management of neuromuscular pain or movement impairments. Dry needling shall be performed only by a physical therapist who is competent by education and training to perform dry needling as specified in the regulation. Online study and self-study for dry needling instruction shall not be considered appropriate training. Each PT who does not obtain dry needling education and training as part of that individual's graduate or postgraduate education shall be required to successfully complete a dry needling course approved by the board in order to perform dry needling. Each course shall include a practical examination and written examination. Each dry needling course shall include the following: anatomical review for safety and effectiveness, indications and contraindications for dry needling, evidence-based instruction on the theory of dry needling practice, sterile needling procedures, which shall include the following: standards from the CDC or OSHA, bloodborne pathogens, post-intervention care, including adverse response or emergency, and assessment of the physical therapist's dry needling technique and psychomotor skills. Each dry needling course shall provide sufficient instruction to ensure that the student is able to demonstrate minimum adequate competency in the following: current dry needling techniques, management of dry needling equipment and supplies, accurate point selection, accurate position of the patient, and education of the patient regarding the amount of movement allowed while the needles are inserted, supervision and monitoring of the patient during treatment, communication with the patient, including the informed consent, and clinically appropriate patient selection, including consideration of the following: the patient's contraindications for dry needling, the patient's ability to understand the treatment and expected outcome, and the patient's ability to comply with the treatment requirements. Each dry needling course shall be taught by a licensed healthcare provider who meets the following requirements: has a scope of practice that includes dry needling, meets the regulatory minimum educational standard in that individual's respective state or jurisdiction, has not been disciplined by any state or jurisdiction licensing agency for any act that would be a violation of the Physical Therapy Practice Act or Healing Arts Act, and has performed dry needling for the last 2 years. Each physical therapist taking a dry needling course shall be required to obtain a passing score on all written and practical examinations given in the dry needling course. Each physical therapist shall obtain a certificate or other documentation from the provider of the dry needling course specifying what anatomical regions were covered in the dry needling course and that the physical therapist passed all examinations. After completion of a board-approved dry needling course, each PT shall be required to complete 200 patient treatment sessions of dry needling before taking each successive course in dry needling. Each PT shall complete all foundational level courses before proceeding to the advanced level course. Dry needling shall be performed solely for the conditions that fall under the physical therapy scope of practice. Each physical therapist performing dry needling shall perform dry needling only in the anatomical region of training completed by the PT. Each PT who performs dry needling shall do so in a manner consistent with generally acceptable standards of practice. Each PT who performs dry needling shall obtain written informed consent from each patient before performing dry needling on the patient. A separate informed consent shall be required for each anatomical region treated by the PT. The informed consent shall include the following: the patient's signature, the risks and benefits of dry needling, diagnosis for which the physical therapist is performing dry needling, each anatomical region for training completed by the physical therapist, and a statement that the procedure was being performed is dry needling and defined by the Physical Therapy Practice Act. Informed consent shall be maintained in the patient's treatment record. Each PT who performs dry needling shall maintain a specific procedure note in each patient's record for each dry needling session. The procedure note shall include the following: the anatomical region treated, the manner in which the patient tolerated the treatment, and the clinical outcome of the treatment. And a physical therapist shall not delegate dry needling to a physical therapy assistant or an aide. Thank you for watching this presentation. If you enjoyed it, please like and subscribe, and please visit us at www.therapycomply.com.